Good afternoon, Anna. How are you feeling today?
I'm all right, Dr. Nad. I recently had some blood work done, and the nurse said you wanted to discuss my results with me. Is there something I should be concerned about?
Thanks for coming in, Anna. I know it can be a little worrying to get called back, but I want to discuss your blood sugar levels. They're higher than normal, but not high enough to call diabetes. You're in a stage we call prediabetes.
Prediabetes? What does that mean exactly? Do I have diabetes?
Not at all, and I'm glad you asked. Prediabetes is a warning flag, signaling that your blood sugar is out of the normal range, but you don't have diabetes yet. However, without changes, around 37% of people with prediabetes develop type 2 diabetes in about 4 years, and most could progress to diabetes within 10 years without intervention. The good news is that this is a stage where you can prevent or seriously delay diabetes with the right changes.
That's a relief, but also a little scary. Can you help me understand what's actually happening in my body?
Of course. Let's start with the basics. When you eat, your body turns food into glucose, a type of sugar that's your main source of energy. To get this glucose into your cells, your pancreas makes insulin, a hormone that acts like a key unlocking the door to your cells.
Got it. So insulin is important for using the sugar from my food.
Exactly. But in prediabetes, your body either starts to resist how insulin works, what we call insulin resistance, or your pancreas can't make enough insulin to keep up. That means glucose builds up in the blood instead of fueling your cells.
So my cells don't get the energy they need and my blood sugar goes up?
That's spot on, Anna. Over time, this can strain your pancreas even further and set the stage for type 2 diabetes if nothing is done. But at the prediabetes stage, many people's bodies are still making some insulin. They just need a reset through lifestyle changes to help things run smoothly again.
Does prediabetes cause any problems on its own, or is it only dangerous if it becomes diabetes?
Great question. Even before diabetes develops, prediabetes is associated with higher risk for heart disease, some cancers, and other complications. Studies now show that damage to blood vessels and nerves can even begin in these early stages, so intervention is key.
That's a little worrying. How would I even know I have prediabetes? I don't really feel sick.
Many people with prediabetes feel perfectly fine, often for years. It's called a silent condition because symptoms can be subtle or completely absent. That's why blood tests are so important. Some people do notice things like increased thirst or frequent urination, feeling more tired than usual, unexplained weight changes, gain or loss, blurry vision, cuts and infections that take longer to heal, tingling or numbness in hands or feet, dark, velvety patches of skin, often in the neck or armpits, more frequent skin infections or changes, such as slow-healing sores or shin spots.
I have noticed I get thirsty more often, and sometimes my skin feels dry or itchy, but I just thought it was part of getting older.
That's common. Many people brush off these early signs as aging or stress. Other warning signs, like persistent fatigue or trouble focusing after meals, can also occur, but they're easily missed. If you ever notice these, especially with risk factors present, it's important to talk to your healthcare provider.
What could someone at risk for prediabetes? I thought you only get diabetes if you ate a lot of sugar.
Eating lots of sugary foods can certainly make it harder for your body to process glucose, but prediabetes isn't caused by sugar alone. Several risk factors increase your chances. Being overweight or obese, especially if you carry weight around your waist. Age 40 or older, though it can happen younger. Family history of type 2 diabetes. Physical inactivity, high blood pressure, abnormal cholesterol or triglyceride levels. History of gestational diabetes, diabetes during pregnancy, certain ethnic backgrounds, indigenous, African, South Asian, Hispanic, or East Asian descent. Polycystic ovary syndrome, PCOS. Sleep problems, like obstructive sleep apnea. Use of some medications, such as steroids or antipsychotics. Low socioeconomic status, due to factors like stress and less access to healthy foods.
My mom developed diabetes when she was in her 50s, and I guess I could be more active. I'm also in my early 40s.
Those are important factors. Studies show over 30% of adults in Canada and the US live with prediabetes or diabetes. Having multiple risk factors doesn't guarantee you'll develop diabetes, but it raises your risk considerably, so monitoring and prevention are vital. Diagnostic criteria and screening guidelines.
How do you actually diagnose prediabetes? Are there specific tests or numbers I should know?
Yes, diagnosis is based on blood test results. Prediabetes is defined by having blood sugar levels higher than normal, but not high enough for diabetes. Here are the main tests. These thresholds are used by the American Diabetes Association, Diabetes Canada, and most global guidelines.
How often should I be tested?
If you're at risk or your results are already in the prediabetes range, we recommend testing at least every 1 to 3 years, possibly more often if you have several risk factors where numbers are rising.
What does the A1C actually measure?
Good question. The A1C test shows the average blood sugar over the past 2 to 3 months. It helps us see long-term trends, not just day-to-day changes. That's why both fasting glucose and A1C are helpful in monitoring prediabetes and diabetes progression. Why prediabetes matters: progression and health risks.
Since the symptoms are subtle, what's the risk if I don't act now? Could I just wait and see if things get worse?
It's tempting, but delaying action can make it harder to reverse course later. About 1 in 3 adults with prediabetes will progress to type 2 diabetes within 4 years, and many more within a decade if they don't make changes. Even before diabetes develops, prediabetes can raise the risk of heart disease and stroke, kidney disease, nerve damage, neuropathy, vision problems, some forms of cancer. Starting early, when changes are easier and the body is more responsive, gives you the best chance at long-term health.
That makes sense. So what can I do about it?
Lifestyle management, dietary strategies. The foundation for reversing prediabetes is lifestyle change. Let's start with your diet. The goal isn't to follow a fad, but to find sustainable, healthy habits that suit you. Here's what research and official guidelines recommend. Focus on a balanced plate. Half non-starchy vegetables, a quarter whole grains or starchy veggies, a quarter lean protein. Eat more fiber. Aim for 25 to 30 grams per day from whole grains, legumes, vegetables, and fruits. Fiber slows sugar absorption, keeps you fuller longer, and helps insulin work more efficiently. Limit refined carbohydrates, white bread, pastries, sugar-sweetened drinks, and added sugars. These cause blood sugar spikes and crashes. Choose healthy fats from nuts, seeds, olive oil, and fish, while limiting saturated and trans fats found in fried foods and processed snacks. Include healthy snacks like a small handful of nuts or cut vegetables if you get hungry between meals to prevent overeating later. Drink water or unsweetened beverages rather than soda, juice, or energy drinks. Dietary strategy. Benefits balanced plate method. Manages carbs, controls portions. High fiber intake. Slows blood sugar rise.
That sounds manageable. I enjoy cooking, but I do like bread and pasta.
Great. You don't have to eliminate them. Try switching to whole grain versions and watch the portion size. The Mediterranean diet is one of the best studied patterns for prediabetes and heart health, emphasizing vegetables, whole grains, healthy fats, fish, and lean proteins.
What about breakfast? I tend to skip or grab something quick.
Breakfast matters. A protein and fiber-rich meal can help keep your blood sugar steady. Good options include eggs with whole grain toast, Greek yogurt with nuts and berries, or a smoothie with leafy greens and protein powder. Avoid sugary cereals, muffins, and juices, which cause glucose spikes and energy crashes. Lifestyle management, physical activity.
And what about exercise? I walk a little, but I don't go to the gym.
You don't need a gym membership. The key is to move more in whatever way works for you. Regular physical activity can help your body use insulin more efficiently, lower blood sugar, and aid in weight loss or maintenance. Here's what's recommended. Aim for at least 150 minutes of moderate intensity aerobic activity per week, about 30 minutes, 5 days a week. That can be brisk walking, cycling, dancing, swimming, or even active household chores. Add muscle strengthening activities at least twice a week, like resistance bands, weights, or using your own body weight with push-ups or squats, which improves muscle sensitivity to insulin and helps with metabolism. Any movement counts. Short bouts of 10 minutes also add up. If you're just starting, begin with small amounts of activity and gradually build up. Make it fun. Walk with a friend, try a new sport, or garden. Even household chores or walking at lunchtime help. The goal is to break up periods of being sedentary and keep active however you can. And before you start a new program, check in with your healthcare team to be sure it's safe for you. Weight loss and behavioral strategies.
How important is losing weight in all this?
For people who are overweight, losing even a small amount, about 5 to 7% of your starting weight, can lower your risk of developing type 2 diabetes by nearly 60%. That's just 10 to 14 pounds if you weigh 200 pounds. The most benefit comes from trimming weight in the belly area, which is closely tied to insulin resistance.
That seems doable, but I always get discouraged if I don't see big changes quickly.
It's normal to feel that way. The most successful approach is to set small, achievable goals, celebrate any progress, and build in accountability. Behavioral strategies, like tracking your food, planning meals, rewarding yourself for milestones, and getting support from family, friends, or a support group, can make a big difference in keeping you on track.
Sometimes it's hard to find motivation, especially with the busy schedule.
Absolutely. That's why support and communication are so important. Consider joining group programs, like the Diabetes Prevention Program, which offer education, coaching, and peer motivation. Many people find that community and regular check-ins keep them much more engaged and successful over the long term. Dealing with setbacks and building sustained change.
What if I have a bad week or fall off track? I worry I'll just slip back into old habits.
It's completely normal to have ups and downs. Changing habits is hard, but what matters most is consistency over time, not perfection. If you face a setback, don't get discouraged. Reflect on what triggered it. Ask for help if you need it, and refocus on your goals. Motivational interviewing, a communication strategy we use, can help identify your personal motivators and barriers, so adjustments can be made in a non-judgmental, supportive way.
That's reassuring. What else can help with making changes stick?
Here are a few tips. Make small, realistic changes, rather than drastic overnight overhauls. Track your progress. Journaling meals or activity can highlight patterns. Use reminders, meal plans, or routines to help with consistency. Celebrate small victories, a week of no sugary drinks, a daily walk. If you hit a plateau or need new ideas, talk to a registered dietitian, diabetes educator, or join a lifestyle program.
I like that approach. It feels less overwhelming.
To wrap up, let's review what we've discussed. Anna, can you tell me in your own words what prediabetes is and what steps you'll take moving forward?
Sure. Prediabetes means my blood sugar is higher than normal, but I don't have diabetes yet. It's a wake-up call that I need to make some changes, or I could develop type 2 diabetes and other health problems. I plan to work on eating more fiber and whole grains, cut down on sugary foods and drinks, get moving more, maybe a dance class, and try to lose a bit of weight. I also know I can check in with you or a dietitian if I need help.
That's an excellent summary, Anna. You're already on the right track. Remember, this is all about progress, not perfection. We'll make a plan together and check in regularly, adjusting as needed.
Thank you, Dr. Ned. I feel much more confident and empowered now.
To everyone watching, if you or a loved one is at risk or has been diagnosed with prediabetes, remember,
early detection is key. Ask your provider about screening if you have risk factors, even if you feel fine. Small, sustainable changes in eating, activity, and weight can markedly reduce the risk of diabetes. Support is available. Don't be afraid to reach out to your healthcare team, join prevention programs, or look for resources through organizations. Change is possible at any age or stage. Be patient with yourself. Celebrate the wins, and know that preventing diabetes is one of the best things you can do for your future health.
Thank you, Dr. Ned. And thank you everyone for listening. Education and small actions really do add up.
Absolutely. Let's continue this journey to health together.
take good care of yourselves. And don't forget to like, comment, and subscribe.